Okay, let's unpack this. Welcome to the deep dive. Today, we're taking a really close look at a veterinary emergency. It's something every dog owner should probably know about, even though, you hope you never actually face it. We're talking about canine splenic torsion.
Yeah, it's a condition that can be incredibly serious. It demands really quick action, and the signs, well, they aren't always as obvious as you might think.
Exactly. So we've looked through some veterinary information notes, research excerpts, that kind of thing. And our goal here is to pull out the really crucial insights for you, the listener. We want to break down what it is, why it happens, the sometimes subtle ways it can show up, how vets figure it out, and, most importantly, what the fix is. Get ready for maybe some aha moments that could potentially help you recognize a really critical situation someday.
Think of it like getting a clear, focused briefing on a vital piece of dog health info without all the super technical jargon.
Right, let's jump in. So first up, the spleen itself. We know dogs have one, but where is it actually, and what does it do for them?
Okay, so the dog's spleen is located up in the front part of their abdomen, kind of on the left side. It's tucked away near the stomach, and it's connected by, like, a stalk, basically, a tether that holds its blood vessels.
Like an apple on a stem, sort of.
A bit like that, yeah, a good visual. And its job is really diverse. It's a vital filter for the blood, pulling out old or damaged red blood cells. It also stores red blood cells, kind of like a backup supply the body can use. And it's involved in the immune system, helping fight infections, and sometimes it can even pitch in making new blood cells.
Uh-huh. So it's a surprisingly busy little organ. Now the problem, torsion. That just means twisting, right?
Exactly. Splenic torsion is when the spleen literally rotates around that stalk, that vascular pedicle. That's the bit with the artery bringing blood in and the vein taking blood out.
And that twist is where everything goes sideways. Let's talk about why that twist is so dangerous. What's actually happening inside?
Well, the tricky part is how the blood vessels react. The vein, the one leaving the spleen, it has much thinner walls, lower pressure than the artery feeding it. So when that stalk twists, the vein usually gets squeezed shut first.
Okay, so blood can still pump into the spleen via the artery, but it can't drain out through that squashed vein.
Precisely. And this causes blood to just rapidly back up and pool inside the spleen. The organ gets hugely swollen. I mean, sometimes, many times, its normal size. We call that splenomegaly. But really, it just means a massive, congested, blood-filled spleen.
And if the twist gets tight enough, I guess the artery eventually gets squeezed shut too.
Yes. As the spleen swells and that twist tightens, eventually even the higher pressure artery gets choked off. Once the blood flow stops completely, the spleen tissue isn't getting oxygen or nutrients. That leads to tissue damage and then tissue death, necrosis. And that's incredibly painful and sets off a whole cascade of other serious problems in the body.
Wow, that sounds like an absolute disaster unfolding inside the dog's belly. What causes this twisting? Is it just like bad luck? Random?
Often we actually don't know the exact trigger. It can just happen spontaneously. That's called primary torsion. But there's a really strong link to another emergency, one people might know more about, gastric dilatation volvulus, or GDV bloat.
Ah, GDV bloat.
Right. That's when the stomach fills with gas and then twists. Because the spleen is physically connected to the stomach, sometimes by ligaments, a twisting stomach can literally drag the spleen around with it, causing a secondary torsion.
Okay, the dreaded bloat connection. That makes sense since they're sort of neighbors in there. Are there other things that might make a dog more prone to this besides GDV?
Yeah, based on the vet literature, some factors seem to pop up. Things like maybe the ligaments holding the spleen are a bit looser than normal. Having that deep-chested body shape you see in certain breeds is a big one. Sometimes if the spleen is already enlarged for some other chronic reason, and maybe even things like really excessive exercise or rolling around vigorously could potentially play a role.
You mentioned breeds. Are certain dogs really predisposed?
Oh, absolutely. Large and giant breeds are definitely seen more often with this. The sources specifically mention German Shepherds, Great Danes, Standard Poodles, and even English Bulldogs. Seems to affect males and females pretty equally, though. No sex predilection mentioned.
Okay, so we've got the what and the why and the types of dogs most at risk. Now, the really practical part. How does an owner spot this? You said it can look very different, acute versus chronic. That feels like a key distinction.
It's absolutely critical because how it presents dramatically changes how quickly you might recognize something's wrong and get help.
Let's start with the acute one, the sudden version. I imagine this looks pretty scary.
Typically, yes. Acute splenic torsion hits hard and fast. You might see a dog suddenly collapse or show signs of really severe abdominal pain like hunched over, pacing, whining, maybe just refusing to move. Their belly might look visibly swollen, bigger than usual. That's from the huge spleen and maybe some fluid building up too.
And signs of shock would be there too.
Definitely. You'd look for pale gums, a very rapid heart rate, maybe weak pulses. Those are classic signs the body's circulation is failing. You might also see vomiting or retching, especially if GDV is part of the picture. Just general weakness, lethargy, sometimes even difficulty breathing if that big abdomen is pushing on their lungs. It's a clear 5-alarm fire emergency.
Yeah, that sounds unmistakable. You'd be rushing straight to the vet.
Yeah.
But what about the chronic presentation? That sounds much harder to pin down.
It absolutely is. Chronic splenic torsion is way more subtle, kind of insidious. The signs are often vague. They can come and go. It can easily be mistaken for just, the dog feeling a bit off or having some other long-term, low-grade illness. You might notice things like intermittent belly discomfort, maybe some on and off vomiting or diarrhea, just general lethargy, maybe weakness, poor appetite, perhaps gradual weight loss over weeks or months.
So not a sudden crisis, but just this lingering low-level problem.
Exactly, and sometimes an owner might notice their dog's belly seems a bit bigger sometimes, or they might even feel a firm lump or mass if the dog lets them palpate their abdomen when relaxed. But here's a really specific clue that sometimes comes up in chronic cases. Urine that's described as port wine colored.
Port wine-colored urine, that's very specific. What causes that?
It happens because of ongoing chronic red blood cell breakdown. When the spleen's congested and damaged over a long time, the red blood cells trapped inside start to fall apart. This releases hemoglobin, the oxygen-carrying part, into the bloodstream. The kidneys filter this free hemoglobin out, and that makes the urine look dark, reddish-brown, like port wine. It's a really key signal, but one that's easy to miss or just dismiss as dark urine.
Wow, yeah, that's a vivid sign to file away.
Hmm.
Okay, so an owner sees something concerning acute or chronic and gets to the vet. How do the vets actually confirm it is splenic torsion and not something else mimicking it?
Diagnosis is really about putting puzzle pieces together. It involves combining the history you give them, what you've seen, how long it's been going on, with a really thorough physical exam. They'll carefully feel the abdomen for pain, swelling, maybe that firm mass, check vital signs for shock. Then comes lab work and, really importantly, imaging.
Okay, physical exam makes sense. Feeling the belly, checking heart rate, gum color. What kinds of things are they looking for in the blood tests?
Blood work gives really important clues. They'll run a CBC, a complete blood count. They'll look for anemia, low red blood cells, which can be pretty bad in acute cases with shock or bleeding. They'll check the white blood cell count, which is often high, indicating inflammation or stress. Platelets might be low, which can affect clotting. Then there's the biochemistry panel that looks at organ function. They might see elevated liver enzymes, partly because the congested spleen messes with blood flow from the gut to the liver. They might see signs of shock, like elevated lactate.
And what about urine tests, especially if there's that weird color?
Yeah, for that dark urine, a urinalysis is key. A dipstick test will usually show positive for blood. But when they look at the urine under a microscope, they often see few or no actual red blood cells. That tells them the color is from broken down blood components like hemoglobin, not active bleeding into the urinary tract. They might also check clotting times because severe cases can develop serious clotting problems called DIC.
Okay, so labs give strong supporting evidence, but it sounds like imaging is where they can actually see the twist.
Absolutely. Imaging is usually the clincher. X-rays are often the first step. They can show the spleen is way too big and often in an abnormal position. Sometimes you can even see this characteristic bent shape on the X-ray, described as a C shape or reverse C shape. That's a big hint it's twisted because of how the attachment point gets pulled. X-rays also help look for free fluid in the belly or check if GDV is happening at the same time.
But is there, like, a gold standard imaging tool for this?
Yes, ultrasound is really the best tool here. It lets the vet see the spleen in much greater detail. They can see how enlarged it is, that its internal texture looks abnormal, maybe heterogeneous. But crucially, using Doppler ultrasound, they can assess the blood flow within the spleen and its main vessels. With torsion, they'll typically see severely reduced or even completely absent blood flow in part or all of the spleen. The person doing the ultrasound might even be able to visualize the twisted blood vessels themselves. Sometimes it looks like a spiral or a whirl sign, kind of like a corkscrew. Ultrasound is also great for ruling out other things, like splenic tumors.
Wow, so ultrasound can literally show the twisted vessels and the lack of blood flow. That's pretty definitive. What if, for some reason, even with all these tests, it's still not 100% clear?
In some situations, yeah, especially maybe those tricky chronic cases. If the suspicion is really high but imaging isn't totally conclusive, the only way to get a definite answer might be an exploratory surgery, a laparotomy. The vet actually goes in to look and feel the spleen directly.
Right. Which leads us straight into treatment. It sounds like if it is splenic torsion, surgery is basically the only option.
It is. Splenic torsion is a surgical emergency. There's no medicine that can untwist it. But, and this is critical, before they can even think about surgery, stabilizing the patient is paramount.
What does that stabilization involve? Getting them ready for the OR.
It usually means aggressive IV fluids, really pushing fluids to combat shock and support blood pressure.
Hmm.
They might use different types of crystalloids, maybe colloids, sometimes even plasma if the dog's really sick or has clotting issues. If the anemia is bad, a blood transfusion is vital. Strong pain meds are essential opioids, usually because this condition is extremely painful. They'll typically start broad-spectrum antibiotics because damaged gut or spleen tissue is prone to bacterial translocation and infection. Monitoring the heart rhythm is really important too because arrhythmias are common. And like we said, if GDV is also present, they'll try to decompress the stomach, get some air out before heading to surgery.
Okay, so stabilize first, then surgery. And the main goal in the OR is just removing the spleen.
Correct. The definitive treatment is splenectomy, surgically removing the entire spleen.
Now, you brought up an interesting point earlier, this decision about whether or not to untwist the spleen before removing it.
Yeah.
Why wouldn't you just untwist it? It seems counterintuitive not to.
Yeah, it does seem logical, but it's been debated for a long time. The big worry with untwisting, especially in a primary torsion, is something called reperfusion injury.
Reperfusion injury, what's that?
Okay, so when the blood flow's been cut off for a while, all sorts of nasty things build up in that dying spleen tissue, inflammatory mediators, toxins, waste products, maybe even tiny blood clots. The concern is, if you suddenly untwist it, blood rushes back into that damaged tissue.
And flushes all that bad stuff out into the rest of the body.
Exactly. This sudden flood of toxins and potentially clots can cause a catastrophic drop in blood pressure, trigger really dangerous heart rhythm problems, or even set off DIC, that widespread clotting disorder. It can make the patient crash.
Ah, okay. So untwisting sounds simple, but it could actually be really dangerous.
It could. So, based on current thinking, for primary splenic torsion where the spleen just twisted on its own, the general consensus now is to ligate the blood vessels first, meaning tie off the artery and vein on the stalk, and then remove the spleen without untwisting it. This approach minimizes the risk of that dangerous systemic release of harmful substances.
Got it. Tie it off, remove it. Don't untwist first if it's primary torsion. Is there an exception? What about the GDV cases?
Yes, that's the main exception. If the splenic torsion happened because of GDV, well, the surgeon has to untwist the stomach first to fix the bloat. When the stomach is derotated, the spleen usually untwists along with it, just because they're connected. In those cases, the surgeon then has to carefully assess the spleen's viability, see if it looks healthy, if blood flow returns. Often, even after untwisting, it's too damaged and still needs to be removed, but the untwisting happens as part of fixing the stomach.
Okay, that makes sense. So the spleen is out. Is the surgery done then?
Well, the surgeon will do a thorough exploration of the rest of the abdomen just to make sure nothing else looks abnormal. And this is really important. The removed spleen should always be sent off to a lab for histopathology.
Histopathology. What does that tell them? Why is it so crucial?
Histopathology means a pathologist examines the spleen tissue under a microscope. It's crucial because sometimes an underlying cancer, like a nasty one called hemangiosarcoma, a cancer of blood vessels, can either cause the spleen to twist or just look very similar, or be found coincidentally. You can't always tell just by looking at the spleen during surgery. The long-term outlook, the prognosis for the dog, depends massively on whether or not cancer is found. That lab report tells you what you're really dealing with long-term.
Right. That makes total sense. Fix the immediate crisis, but find out if there's a ticking time bomb underneath. And if the dog had GDV or is one of those breeds prone to it anyway.
Good point. If GDV was present, or even if it wasn't, but the dog is a large, deep-chested breed known to be at high risk for GDV, the vet will almost always recommend performing a prophylactic gastropexy during the same surgery. That's the procedure where they tack the stomach to the inside of the body wall. It doesn't stop bloat, the stomach filling with air, but it significantly helps prevent the life-threatening twist volvulus, from happening again in the future.
Okay, surgery's done, maybe gastropexy too. What's recovery like? What kind of post-op care is needed?
After surgery, it's usually pretty intensive care for a bit. They'll continue IV fluids, need good pain management, continue antibiotics, and monitoring the heart rhythm is incredibly important, especially for the first 24 to 48 hours. Ventricular arrhythmias, those irregular heartbeats originating from the bottom chambers of the heart, are really common after splenectomy for torsion. If these arrhythmias become significant, they need to be treated with specific medications.
So keeping a really close eye on the EKG is a big part of post-op.
Absolutely. They'll also keep monitoring blood work, checking for ongoing anemia, watching platelet counts and clotting function, making sure the kidneys are handling everything okay. There's also a known risk of pancreatitis, inflammation of the pancreas, developing after this kind of major abdominal surgery, so they watch for signs of that too. And of course, once the dog goes home, strict rest is key. Leash walks only for potty breaks, no running, jumping, stairs if possible for probably a couple of weeks to let that incision heal properly.
How does all this add up for the dog's future? What's the prognosis generally like?
The prognosis is generally good if the condition is caught quickly and the dog gets to surgery promptly, especially for primary torsion without major complications or underlying cancer. Survival rates reported are often quite high, like over 80%.
That's actually pretty encouraging. When does the outlook become less positive?
Well, the prognosis gets more guarded, or worse, if the dog is in severe shock or has evidence of significant organ damage before surgery, or if they develop really serious post-op complications like those uncontrolled heart arrhythmias, severe bleeding problems, or DIC. But honestly, as we talked about, the long-term prognosis really hinges on those histopathology results. If an aggressive cancer like hemangiosarcoma is found in that spleen, unfortunately, that becomes the main driver of the long-term outlook, regardless of how well the torsion surgery went.
This has been so much critical information. If you had to boil it down for someone listening, what are the absolute key takeaways they should remember from all this?
Okay, key points. First, recognize splenic torsion is a life-threatening emergency, especially in those large, deep-chested breeds. Second, the signs can be tricky. They can range from sudden dramatic collapse to really vague, intermittent off periods. And remember that weird port wine-colored urine clue in chronic cases. If you suspect anything like this, don't wait. Get your dog to a vet immediately. Time is absolutely critical.
And diagnosis involve putting clues together, exam, labs, but really leaning heavily on imaging, especially ultrasound, to see that twist and lack of blood flow.
Exactly. Treatment is emergency surgery to remove the spleen, splenectomy, usually without untwisting it first in primary cases to avoid those nasty reperfusion issues. Remember the strong link to GDV bloat and the absolute necessity of sending the removed spleen for histopathology to check for underlying cancer. That biopsy result really changes the long-term game plan. And while it's a major event, and yes, can be costly, the good news is dogs can actually live perfectly normal, healthy lives without their spleen.
So canine splenic torsion. Definitely serious, sometimes sneaky, but often survivable with prompt action. It really underscores how important it is to be tuned into your dog, notice changes, and act fast, especially with those high-risk breeds.
And it's a great example of how powerful modern veterinary diagnostics like ultrasound are for finding these hidden internal problems.
Thinking about this, how a dog can go through such a dramatic internal event, lose an entire organ that does multiple important jobs, and still, in most cases, recover and live a full, happy life. It's kind of amazing, isn't it?
It really is.
That resilience, the body's ability to compensate, it just makes you appreciate how adaptable living beings are, especially when faced with these critical challenges.
It's truly incredible. It really highlights the body's sort of built-in backup systems and its capacity to adapt even after major surgery, like removing the spleen.
An amazing thought to leave you all with. Thanks for taking this deep dive with us today.
My pleasure. It was great talking through it.